Hello everyone, welcome to the CTV News on Calabash TV and on the Wave Radio 94.5. I am Lisa Joseph. Well, against public clamor for a better health care system and delivery, the Ministry of Health and by extension the government of St. Lucia has been challenged to do more to improve the quality and standard of care here. The challenge was issued by visiting consultant, the gastroenterologist and hematologist Dr. Solomon Morea. Dr. Morea and his team of specialists from the Bradford Teaching Hospital in the UK completed a week of training at Victoria Hospital in colonoscopy and endoscopy. This is the third such collaboration in the last 2 years.
When we arrived here, you had some equipment from Olympus. Your nurses, I remember we came in on a Saturday, we realized the nurses weren't trained enough. We spent time on a Saturday to train them. They stayed behind until 6 o'clock, and look at them now, they are fully independent. On that occasion, you were given some special software worth £70,000 for this hospital, £70,000 for St. Jude, by Mr. Steve Rainey from Unisoft, and I'm so pleased that the software is still working, that you are doing your report. The level of endoscopy here and the level of reporting is very, very close to what we do in the UK. So you have an electronic record of all the endoscopy that you do here. It's printed, it goes into the notes. If you lose the notes, we can access it on the computer.
Dr. Morea says the improved skills and capabilities of local doctors have been pleasing to him. The aim now is to transform them into trainers. The visiting medical expert, however, recognized that much more can be done to benefit the local population if more resources are available in the health system. He called for government to play its part and the Minister for Health to lobby for the improvements.
And therefore we need to consolidate this. So we've come here the first 2 days, we consolidate the knowledge that has been imparted before. Really pleased to see that there's been no slacking, that the people are on the same level as we left them last year. So we want to take them to the next level. So you saw yourself how we worked with Dr. Remy to do this complicated procedure upstairs. This is the first time she's done this. And hopefully during the week she'll do this a second time. And we've taught this to Dr. Kabir before. And she may need a bit of help, but there are people here to support her. So from having 2 people who can do it, in 2 weeks' time you'll have 3 people who can do it. So we take these people who have got basic knowledge to the next level. Then we want to take them to the further next level, which is for them to be trainers. So they can train the first generation. What we don't want, what our team doesn't want, is to have to come here and train people from scratch. We've done this once. We're going to give people the tools to train the next generation, and then we will come and polish up the next generation rather than be completely indispensable. We don't want to be indispensable. We really want to come and do a job and then enjoy ourselves. So what do we need, where we really need to be is we need to be in a place where the doctors feel that they can rely on the ministry to back them up with very sophisticated equipment. It is expensive, but once we invest, let's say in 3 or 4 scopes, okay, each scope is about $30,000, 4 scopes, you can do the calculation, but they will last you for 5 years because your doctors are really well trained, your nurses are really well trained, they will look after the scopes.
Minister Alvina Reynolds accepted the challenge, saying that the next time the Bradford team visits, their training sessions would probably take place within the walls of the new National Hospital.
You have given me my homework, and that is to ensure that we have equipment, that there is maintenance, and that we project for long term. Don't only do it for this end of the year or next year, but look towards more long term and invest in this equipment. And of course, this is our homework here in St. Lucia. After we've gotten such an important gift, that's the best that we could do to say thank you to you, to ensure that we maintain, to ensure that we invest our resources, our money, into procuring new equipment, but more than that, to afford opportunities for training to other younger doctors. And this is what you said you wanted to see. Trainer of trainers, where you train those to be the best, and next time you come, you see a new batch of persons who have been exposed. And through this discussion, I think just for a little moment, we're looking at how can our hospital here and his hospital form a bit of a partnership. What more can we explore as it pertains to knowledge and skill? Because science evolves, medicine, and so they are from the developing world, and they may be quicker to pull on something and get new research going. And we do not want to be left back in St. Lucia. Not only knowledge and skill, but the attitude that we want to see among our medical personnel. And I look at Dr. Morea this afternoon. He was telling me about the training, how it's done. And he took time to explain to me that the trainers do not raise their voices at anybody. If they see something is going on, they would say stop and very calmly bring the person, the trainee, to the correct point. And that, I think he was saying, giving me a message, and this is what I, more than anything else, appreciate. We can be very bright and very skillful, but the attitude that we use to train or even treat is what's most important. The respect and empathy, the time, the compassion that we use for our patients, critical.
Health Minister there, Avina Reynolds.